All right, let's talk about becoming a doctor. It's one of the toughest roads you can take, education-wise. So today, we're going to pull back the curtain and really look at what it takes to go from a total newbie to a physician. Ready? Let's dive in. So, when I say medical school, what's the first thing you picture? Is it just endless nights, a mountain of textbooks, someone hunched over trying to memorize every single bone and body part? Yeah, that's the classic image, right? But is that really all there is to it? Well, the reality is so much bigger than that. It's not just about cramming facts into your brain. It's a total transformation. I mean, it's a journey that takes you through intense science, hands-on hospital work, and even into understanding the very human side of medicine. Okay, so to really get a grip on this, let's break down a pretty standard framework. We'll look at the 6-year program you see in places like Taiwan. Think of it as a roadmap for building a doctor, step by step. This whole journey is really split into 3 main parts. First up, you've got years 1 and 2. That's all about laying the groundwork, the solid scientific foundation. Then, from years 2 to 4, you dive headfirst into actual medicine. And here's something cool about modern programs. They get you into the clinic way earlier than they used to. Finally, you hit years 5 and 6, and that's when you're in the hospital, putting everything you've learned into action. So let's start at the very beginning. And here's something that might surprise you. The path to treating diseases doesn't start with diseases. Nope, it starts with science. It's all about learning to think like a scientist before you can think like a doctor. So in those first couple of years, you're buried in courses like biology, chemistry, physics, but also stuff like stats, psychology, and sociology. And the real goal here isn't just to ace the tests. It's about building this mental toolkit for scientific thinking and logical problem solving. These are the skills that are going to be absolutely essential for everything that comes next. Okay, once that foundation is rock solid, it's time to get to the core of it all, understanding the human body and how diseases work. And yeah, this is where all those classic med school subjects you've heard of finally make their grand entrance. You know, we're really talking about the big 3 here. You've got anatomy. That's the what, the actual structure of the body. Then there's physiology. That's the how, how all those parts work together. And finally, pathology. That's what happens when it all goes wrong. These 3, they are the absolute bedrock of medical knowledge. And this really gets to the heart of the thinking process they have to master. It makes perfect sense when you think about it, right? You can't possibly know what's wrong with something if you don't know what it's supposed to look like when it's right. So it's this logical chain. First, understand normal. Then, learn to spot the abnormal. And then you can diagnose the disease. It's a way of thinking, not just a list of facts to memorize. Now here's something that's really changed in medical school recently. In the old days, you might learn all the anatomy one semester, then all the physiology the next. But now, it's all integrated. So for example, when you're studying the heart, you learn its anatomy, how it works, what can go wrong with it, and even look at real patient cases, all at the same time. It's a game changer because it connects the books to real people, right from the get-go. All right, so all of this classroom learning is building towards something big. Because after a few years of lectures and labs, there's this massive shift. It's time to leave the classroom behind and step into the real arena, the hospital. And this is where they do what's called rotations. They literally move through all the big departments. We're talking internal medicine, surgery, OBGYN, pediatrics, psychiatry, neurology, you name it. It's their chance to see what each specialty is actually like day in and day out. And this is where the learning itself totally changes. See, those first few years are all about soaking up knowledge from books. But now, in the senior years, it's about something way harder. It's about taking all of that information and turning it into real-world clinical judgment. It's about making decisions that have real consequences for real patients. Everything, I mean everything, leads up to this, the final 6th year. This is a full-blown, all-in internship. It's basically the final boss battle before they can earn the title of doctor. And honestly, this might be the biggest change of all. Before this point, you're a student. Your job is to learn. But during the internship, your job becomes caring for patients. Yeah, you're supervised, but you are doing it. The responsibility, the pressure, it all becomes very, very real. But being a great doctor is more than just knowing all the science. It's more than just making the right diagnosis. There's this whole other side to it, a side that's just as important, the human side of medicine. And that's exactly why med schools focus so much on humanities. We're talking about things like medical ethics, how to actually build a relationship with a patient, and communication skills. Because let's be real, sometimes the words a doctor uses can be just as healing as any prescription they write. It really boils down to this one simple but super powerful idea. You don't treat a disease, you treat a person. You're not just looking at symptoms on a chart. You're looking at a human being who has a family, who has fears, who has a whole life. That's what the training drills into you over and over again.
So, okay, we've talked a lot about what they learn, but what about who they are? What kind of person actually makes it through all this? What does it take on the inside to succeed? It really all comes down to your personal inner compass.
To really succeed here, you need this crazy mix of qualities. I mean, okay, being able to study like crazy for years, that's a given. But just as important is having empathy, a really strong sense of responsibility, being a good team player, and maybe the biggest one of all, you have to be ready to be a student for the rest of your life, because this field is always, always changing. So if any of this sounds like a path you might want to walk, let me leave you with a few questions to really think about. First off, are you genuinely, deeply curious about the human body? Do you just have to know how it works and why it sometimes doesn't? Second question, can you honestly handle years and years of high-stakes pressure? And I mean the kind of pressure that comes from knowing someone's life and health are literally in your hands. And last one, are you okay with the fact that graduation day isn't the finish line? It's really just the starting line for a lifetime of learning. Because if you want to be a great doctor, you have to be a great student. Forever. Look, if you can genuinely answer yes to all of that, then this path, as tough and as demanding as it might just be one of the most incredible, most rewarding ways you could ever choose to spend your life.